Good morning, everyone. On behalf of the University of Utah, we are proud to be standing with Governor Herbert and all the many distinguished guests here today in support of the Healthy Utah plan. As citizens of this great state, we have a lot to be proud of. And some of my favorite data that I like to share with my colleagues across this country is captured in this graph. And I know you can't all see the graph, but I'll describe it to you. Once a professor, always a professor, I'm sorry. This graph plots all 50 states in the country, and it plots those 50 states based on healthiness of the state against the healthcare expenditures per capita, how much we spend per person on healthcare. And in all the 50 states, there's this corner that I call the sweet spot, where we have the healthiest population at the lowest cost. And there's just one dot in that corner, and that's, can you guess? Utah. And our costs are actually almost half of the most expensive state in the country, which is Massachusetts. This slide really captures, I think, the essence of what we're about at the University of Utah, and more importantly, what this great state is about. We provide value, we deliver great outcomes to our communities, and we deliver that health the most efficiently of any state in this country. We're about quality, about efficiency, and about using our resources wisely. And as a result, we find ourselves leaders in this country, and we're there because of the great work of the leadership of this state with Governor Herbert, the legislature, and the many leaders that stand behind me and elsewhere across the state. And they have thought very wisely about how to use our funds, and they've thought compassionately, as we just heard from the bishop, about how to take care of our people. We've come to an important junction, I think, in the history here of Utah, and we are very grateful to the governor and his team for the careful and deliberate study that they've put into this problem over the last 18 months, and really listening to all the people across the state, and frankly negotiating what we believe is a remarkable set of concessions from the federal government in order to do this the Utah way. And that's why we are here supporting the governor's Healthy Utah plan, because we want to continue to be leaders in the country. We want to continue to do better, delivering value to our people, delivering high quality, compassionate care, and at reasonable costs. I just want to comment briefly on how we as providers are so confident that expanding healthcare coverage to the presently uninsured is really cost effective, that it really will save the state money and also make our state healthier. There's national data that shows that when other states have moved from uninsured to insured populations, hundreds of thousands of people in those cases, there's been significant improvement in health and many, many lives saved. At a more local level, at the University of Utah, in our own experience, we know that having an uninsured population is costly, not only to us, but to the whole state. Just last year alone, the University of Utah Healthcare provided over $100 million in uncompensated care. And those costs are real to us, and they are costs that other systems also bear, and they are dispersed across our entire economy. And we know that they are so much higher than they would be if all those people, many of whom are employed, as we heard from the governor, actually had access to health insurance, access to health care in a reliable way. And not measured in those dollars that we would save also is the suffering and the loss of productivity of all those individuals that we take care of, regardless of whether they have insurance or not. And we know that, and it's frankly common sense. We know that it is better to have individuals see primary care providers and take their 10-cent a day blood pressure pills than to show up in our emergency rooms with strokes and heart attacks. It's better for our diabetics to maintain their blood sugars with primary care providers than to face the consequences of blindness, kidney failure, and amputation. And it's better for our pregnant young women in this state to receive good prenatal care rather than have premature babies and all the complications. In fact, we know that for normal full-term births, they cost about $4,500, but for those preemies, just the first year cost alone are $81,000. So it's clear that that kind of preventive care is good health care and will save money and provide better health care. So that's what we want for our state. We want to save lives, provide better health care for all, and I'd just like to say in closing that as a citizen of the state, like all of you, I would very much like our state to support an investment in better health for everyone in our state, all of our citizens. We have an opportunity now to make a state investment that can be leveraged ninefold with federal dollars, and those federal dollars, as we heard from the governor, just happen to be our own tax dollars that we're paying out, and we'd like to get those back to us. And as a leader of the University of Utah Healthcare, I'm here to say that we are committed to using those dollars wisely and efficiently and to provide real value for this state and to continue to lead the country in health and in affordability of healthcare. Thank you.